Good afternoon, and welcome to a webinar on own label and private label distributor responsibilities, hosted by EAS Consulting Group and presented by EAS independent consultant Bruce Elsner. EAS is a member of the certified group of companies and is a leader in regulatory solutions for industries regulated by FDA. Our global network of over 150 independent advisors and consultants enables EAS to provide comprehensive consulting, training, and auditing services, ensuring proactive regulatory compliance. Today's presenter is independent consultant Bruce Elsner. Bruce has over 30 years of experience working in FDA-regulated industries and has held oversight positions in laboratory management, process control and improvement, plant quality assurance, and quality systems. He consults in dietary supplement and OTC firm GMP compliance, quality system improvement, and helps firms respond to complex issues arising from FDA inspection observations, warning letters, and consent decrees. And he conducts training to ensure personnel are up to date with all FDA expectations. As a reminder, during today's webinar, you may type any questions into the questions box, and I'll send a copy of the slides and a link to today's recording on the next day. And now, with that, I will say thank you for joining EAS, and I'll turn the presentation over to Bruce.
Thank you, Amy, and hello, everyone. This presentation, as you know, is about own label and private label distributor responsibilities. And the seminar is intended to help you understand how meeting those responsibilities will ensure that what you want your products to be are what they should be, and that your CMOs, your contract manufacturers, and you are in compliance with FDA regulations. So let's begin by asking the question, am I an own label distributor or private label distributor? And by the way, I'll be using those terms interchangeably and typically refer to them as OLDs because the requirements for both are very much the same. I'll call out the differences when there are some. So you are an own label distributor if you are contracting out some or all of these items listed: manufacturing, packaging and labeling of products, including laboratory testing, and warehousing and distribution. We find that own label distributors do some or all of that contracting out. Some they do themselves, and there's every combination that you can think of, but it still makes you an own label distributor. So let's look at what FDA says about you and your responsibilities. First, these observations are from actual FDA warning letters, and they very specifically and carefully wordedly say what your responsibilities are in terms of, in the eyes of the FDA. And in this case, I'm going to read much of this verbatim just because every word is pretty carefully chosen when the FDA issues these. And the first is that your firm has ultimate responsibility. You'll see that phrase often. And in this particular slide, that although you contract out certain operations, your firm cannot contract out the responsibility to ensure that the dietary supplement is not adulterated for failure to comply with CGMP regulations. And I want to emphasize the carefully chosen word there, adulterated. That means that in the eyes of the FDA, if your product is not in compliance with regulations, whether or not it meets specifications and is otherwise perfectly good product, but was not manufactured under CGMP regulations, they may deem it to be adulterated. And that word is important because if they decide to do that and it involves your total operations, or in this case, your contract manufacturer's operations, you then may be restricted from ever distributing and selling those products. Another common statement we'll see in warning letters is that you have an obligation to know how these activities are performed, that is the CGMP compliant activities, making your products, and that they conform to established specifications. In other words, you're required to know that, and whether to approve and release the products for distribution, so that you can make that decision. And this is pointing out clearly that that is your responsibility. It cannot be delegated. You have responsibility for releasing each lot of your product for distribution. That sometimes comes as a surprise to some folks, but that is a clearly established requirement. Now, let me indicate to you some kind of observations that the FDA typically will make, and is the basis for them saying you're not following CGMP requirements. So, taking some data from 2019, you can see from these pie charts that for roughly a 10-year period prior to 2019, and including that, and even as of the 2019 data itself, key observations most frequently were specifications and testing, and the other three in the top five were master manufacturing records, batch production records, and quality unit operations. That means they are commonly finding compliance requirement regulations. Finding problems with complying with the regulations in those specific topic areas. So let's get into what you have to do to meet your OLD responsibilities. And basically, it falls into four main categories. First, you have to qualify your contract service provider, your contract manufacturer. You have to establish a quality agreement. That is our opinion and recommendation. It's not a regulatory requirement, but I can tell you that inspectors, FDA inspectors, are now commonly asking contract manufacturers and the own-label distributors whether there is a quality agreement established. You need to meet your quality unit responsibilities. That's a big one, and we'll go into considerable detail on that. And you have to establish a monitoring process for your contract manufacturers. That is, you monitoring them. So if we look at what is involved in qualifying them, there are these key steps to go through. There's almost always, and used to be typically only, a CGMP compliance self-assessment questionnaire. I said that used to be only, that's no longer considered by itself to be adequate. So you must do some other things, which include having an initial CGMP compliance audit conducted. And that would be done by your own quality unit if you have qualified people to do that, or a qualified third party. Qualification of the certificate of analysis data that you're using in the process. We'll get into that later, but certificate of analysis data must be qualified to use that data. We are advising clients that if you have properly qualified your contract manufacturer, it's okay to use that C of A data. Need to periodically requalify that C of A data. That means that either you are requalifying or continue to maintain the status of your CMO, or you're doing some outside parallel testing of that samples on which that data relates to see that you're still in agreement with the C of A that is being presented to you from the contract manufacturer. And you should be in that program assigning qualified, conditionally qualified, disqualified, requalified statuses so that it's clear what your status of those contract manufacturers actually is. So let's take a look at the second major requirement, and that was establishing a quality agreement with your contract manufacturers. This is not required by regulations, as I said, but the FDA is asking about it pretty regularly. So we strongly recommend it. It's not the same as a business contract, but it may be an addendum to a business contract or a totally separate document. And basically, it's as indicated here, it lists the quality unit responsibilities required throughout the regulations 21 CFR 111 and 211 for dietary supplements or drugs, respectively. It will indicate the responsibilities by the OLD, PLD, the contract service provider, and if those that are shared by both. Topics typically included in a quality agreement are quite a few, and I'll go through this fairly quickly. You can follow up some of the rather self-explanatory items, but I want to highlight a few. The last 3 bullet points, particularly detailed assignment of quality unit responsibilities. And we always recommend that this could best be done by establishing a table of responsibilities where you can clearly indicate whether it's the contract manufacturer or the OLD, or both have shared responsibilities for the various items listed. Key document approvals and document sharing. Who has responsibilities for document approvals and what documents are to be shared, provided. And of course, there needs to be clarity on how product release is being handled. Some additional topics also include particularly review of deviations and out of specification results that are discovered along the way, generation of data to support expiration or best used by dates where they are used. And if we skip down another one, notification of regulatory inspections, observations, and responses. You want to know if your contract manufacturers are having inspections, what the results of those inspections were, and how they've responded to those inspection findings. And signatories, and there may be some other topics that you decide within your own organization you want to have in that quality agreement. So let's now dive into the third key area of responsibilities, and that is responsibilities of the quality unit itself. And by quality unit, you'll find that the FDA refers to, in the regulations, either QC, or sometimes they'll mention quality unit. They typically do not use the term quality assurance for some strange reason. We often, in industry, will use quality assurance or quality control to cover both of the sets of responsibilities associated with the whole quality effort. The very first thing, which seems obvious, but is not always in evidence, is that you need to have an established quality unit. And what is a quality unit? It can be one person, it can be more than one person, even with some shared responsibilities by others who have operational responsibilities. That latter is normally for very small companies who have a very limited staff. But at any rate, you have to have established and identify what is your quality unit. You have to document those QA, QC responsibilities, and you have to approve all CGMP related documents. That's quite a list of documents, but the approval, if they are not ones that are generated by you, that may be indicating you're okay with them by reviewing them, initialing and dating them and keeping them on file. But any SOPs that are your own for your own operations and responsibilities at your headquarters location, they need to be established by you and approved by you. Specifications also need to be developed and approved. And if they're for dietary ingredients or non-dietary ingredients or active pharmaceutical ingredients in the case, and excipient ingredients in the case of drug products that are unique to the product owner, then if they are unique to you and not part of what the contract manufacturer normally is dealing with, then they should be your specifications developed and approved by you. Developed can mean in collaboration with your contract manufacturer, but they need to look like they are your specifications approved by you, and then forward it to the contract manufacturer for their use. That also same for primary packaging materials, and certainly for the product specification, both bulk product and finished product. Product formulation also needs to be a formally established and approved set of documents for each product formulation. Other documents requiring approval will include things like master manufacturing and packaging records, the final release documentation for distribution of the product. We'll talk more about that briefly in just a bit. Expiry and best use date interval determination. That decision on what interval you're going to use for your expiry period, whether it's 12 months, 18 months, 24 months, how that was approved needs to be documented and approved. That can be in conjunction with the contract manufacturer, but there should be evidence that you have seen and agreed with that interval determination. Material reviews, nonconformance investigations, we've mentioned briefly earlier. The review and okay of that final report needs to be is a responsibility of your quality unit. Change control, there should be procedures in place for managing change. That's a rather involved topic, which we won't get into detail in this presentation, but change control needs to be managed and the proposed changes need to be reviewed and approved. And you should at least have reviewed change control documents from your contract manufacturer and indicate that you're okay with them and become part of your records. Then product complaint investigations, particularly the final report, is a responsibility of your quality unit to sign off on. And you need to maintain evidence of all of those documents we've just mentioned on file at your location. You need to ensure, of course, that maintenance of product distribution records exist. They can be at your contract, if your contract service provider, contract distribution center, if you're using one, or those records would reside in your own location. And you need to maintain ongoing monitoring records of related to your contract manufacturers. And with a quality agreement, you need to have approval by your quality unit and be on file. So I'm talking about having qualified personnel to do these various things. We need to talk just briefly about training. So you need to have a training program established for those kinds of activities and functions that happen within your own facility. That is, if you are doing, for instance, any secondary packaging or just labeling, or you're doing the actual distribution, you need to have training to show that. You need to have training to show what kind of training is required. You need to have a training requirements list or matrix, but based on each job category, so that that can be managed and kept current. That is, the training kept current for all of your people involved. If you are doing packaging, warehousing, laboratory work, or distribution at your facility, and some contract manufacturer, some OLDs, PLDs are, then you need to also include provision for job skills training. And you need to retain a complete file of all the training records. So let's go on to a few basics about developing standard operating procedures. They need to cover all appropriate CGMP compliance requirements that apply to you and your operation at the product owner corporate level. In other words, they're your SOPs. We're not talking about contract manufacturers' SOPs. These sometimes will be used by you to communicate your requirements to your contract manufacturer. So they could be covering things that may be addition to what you're doing locally, but they would also always include what you are responsible that you do locally. You need to document the quality unit approval of all of these SOPs you create, and they would include qualification and monitoring of contractors, and basically include minimally all of the topics that we're covering in this presentation. They should not be structured in a way of a policy document. That's much too general to know how people are to actually execute doing that particular operation. So they should be written more in the context of a how to do document. And when they are done that way, they then serve as training, and should serve as training documents. Let's talk a little bit more about the creation and approval of specifications, because that's always an area fraught with many questions. Those specifications for items listed below that are by the OLD, PLD, R&D technical group and approved by OLD, PLD, QA could include and would include, if there are items that are unique to you as the OLD, because they may not be in existence at the contract manufacturers already. So things like ingredients unique to your products, bulk product labels and labeling, again, they'd be unique to you. Primary packaging materials that are unique to you, and provided these documents, you'd be providing those to the contract manufacturers. You're saying, here are the specifications for what you're doing for us with these materials. Those specifications that would be created by the contract manufacturer would be ones commonly in their inventory. And so that could be things like ingredients commonly that they're using for producing other people's products as well as your own. Packaging materials, same thing. And they must be approved by the contract manufacturer's quality unit with evidence that you have seen them and that you're okay, accept them and have on file at your location. So while still on documents, let's talk about manufacturing records. And here we start with master manufacturing records, a very key point. They need to be established for every product, formulation, and batch size. That's important. Each formulation and batch size. So if you have different batch sizes for the same product formula, you need to have a master manufacturing record for each batch size. Ingredients that would be specifically identified in those documents, that is by name and item number, amounts calculated for from an approved formulation. You need to know that the amounts prescribed in the master are taken from an approved formulation. All key processing steps would be described, and there would be fields included for people to verify that they performed that step, and someone else separately has verified that. There needs to be provision in that document for yields to be determined and stated and compared to an allowable range that is stated on those documents. And they should be co-approved by the product owner, that's you, and the contract manufacturer's QA unit. They're going to be, as we said, originally developed by the contract manufacturer in almost all cases, but there should be some evidence if you have agreement and they're okay with you co-signing those documents. If not, and there may be some issues on the contract manufacturer's side of not wanting that done that way, you should at least have a copy of those and show that you have reviewed and agreed with them and kept them on file at your corporate offices. Master packaging records, the packaging steps, very much the same master records as we've just described. The only difference is, or the key difference is that if you are using inspection on the packaging line, or that they are, I should say, your contract packager, manufacturer packager, having a electronic capability to identify that the label is in place on the units going down the line, and not only in place, but is the correct label. If you have that degree of electronic verification, then you do not need to do label usage reconciliation. Otherwise, you do need to reconcile the use of all labels for each product lot. Yields are required with allowable range. Again, these documents would be co-approved, just as we've said, for the packaging master records. But now let's talk about what follows those, and that's the generation of the individual batch production records. First of all, they must be true replicas of the master records. This is often a problem, and it's cited by the FDA commonly. And it's easy to find by an inspector in 15 or 30 seconds of just looking at the records. The issue is that many companies have, for convenience reasons, developed two databases, one in which they keep the master documents and one from which they issue the individual batch records. It's not quite clear why they do it that way, but what can happen, and often does, that I found in my own experience, that some companies will find that people are making changes to their database where they have the records from which they issue the individual batch production records. And after a while, those changes become significant, no longer in agreement with the masters, and that becomes a problem. All key process steps must be double verified, as we said the master calls for, and all entries must be real time. Real time is a particular issue. An FDA inspector or yourself should know from the auditing you've done in qualifying your contract manufacturers that that is happening real time. And when we have seen, not too rarely, unfortunately, that sometimes those verifications are done either before an operation or many operations begin, or at the end after they have already happened. And if people are documenting the individual batch production records that way, that is considered a falsification of records, which is actually a criminal offense. You want to make sure that's not happening at your contract manufacturers. Yields at key points in the process are required and must meet allowable ranges, as we've said before. Now, if you, for your products, if for particularly dietary supplements, if you're using expiry or best used by dates, or for expiry dates on your labeling, a couple of words about expiration dating. Must be supported by stability data. It's required for drug products, of course, and it's voluntary for dietary supplement products. Some dietary supplement product producers are using expiration dating or best used by dating. If so, in any case where that is in place, you need to be following an established stability testing protocol. And this is an example of two cases where the protocols are established, one by the International Council of Harmonization and the other by the FDA for drug products. For dietary supplement protocols, you have some freedom of how to modify those to be what you would feel is adequate. It's your call. Typically, you're required to have accelerated 6-month accelerated testing to project your stability, your expiration, best used by dates if you're using them. But we know that many companies do use 3 months data to make that projection. The FDA doesn't seem to be overly concerned with that as long as you have a program in place to continue for 6 months of accelerated testing and followed by room temperature testing throughout the whole expiry period that's been declared. And when we talk about room temperature testing, that's to confirm, as I just said, that expiry date you're using, and that the dating interval that is developed and agreed to for each product package combination must be approved by QA, by the QA of whoever is generating that data. And it should be also reviewed and approved or found to be okay and documented that way and put in your file. Stability requires that you do at least one lot on test at room temperature throughout the entire product life. That means if how many years you're producing that product, selling that product, you need to have room temperature stability data available throughout the entire life of that product. So let's consider dealing now with what we mentioned earlier, non-conformance issues. In the dietary supplement world, they're referred to material reviews, and in the drug world, they're typically referred to as non-conformance investigations. These are typically done by the contractor, the contract manufacturer, or the contract lab. The formal investigation is done and a report must be issued. And it's kept on file, and a copy of the should be going into the batch folder for each product lot it's involved. It's required for, and this is taken from the dietary supplement regs, but it's the most clear explanation of what should be included, not only for dietary supplement, but for drug products as well. Conducting material reviews, conducting non-conformance investigations when there's an out-of-spec lab result, there's a confirmed product non-conformance. That means the lab result was found to be valid, and therefore there is a established non-conformance out-of-specification condition for the product. If there's a deviation from the master manufacturing or batch production record, if there's some unusual event that happened in the plant that could potentially impact the quality of the product, if there's a serious calibration issue with scales, balances that are used to weigh out ingredients and product, and if the product is returned before it can be decided to be put back into inventory, if there are no issues, that must be investigated and report issued. These reports require the contract manufacturer quality unit approval, and the on-label distributor PLD's quality unit must be notified and copied so that you have a chance to review them and concur that things are in order and you're not dissatisfied or unwilling to accept what they've done to deal with these non-conformance issues. The final report is to document the product owner quality unit okay, and that's you folks, and be part of your file. Okay, so you've got the product manufactured and packaged by your contract manufacturer. So what is needed to approve the product for shipment from the contract manufacturer to you or to your distributor if you're using a contract distributor? Obviously, all specifications must be met. The product should not be shipped in quarantine awaiting any test results. We know that that happens. The FDA doesn't particularly get too excited about that as long as it's rare, not the routine. Then the approval authority may be delegated, and typically is, by the contract, by the on-label distributor, private label distributor. That authority can be delegated to the contract manufacturer. And that is approval authority only to ship product from the CMO's facility to you or to your designated distribution facility. The final batch folder quality, a final batch folder quality approval checklist, which is something that we recommend using, goes to the product owner, quality unit, and the distributor if a contract distributor is used. That document, that batch folder quality checklist, or an equivalent document, is to verify that all associated records with the associated with the manufacture and control of the product are in place, have been reviewed, and found to have been okay. The certificate of analysis goes to the product owner, the quality unit, and the distributor if used. It's issued, these documents are issued by the contractor, and a copy of C of A batch folder quality approval checklist or equivalent must be maintained by the product owner quality unit. That's to release the product from the contract manufacturer. Now, what about releasing the product for distribution? This is a key absolute requirement that some on-label distributors, private label distributors, well, particularly on-label distributors, sometimes are not fully understanding and taking responsibility for, but you must be the sole approver of your products, each product lot, for distribution to your customers for sale. That cannot be done by anyone else. Must minimally be based on, as we've just pointed out, properly documented certificate of analysis from the manufacturer and this approved batch folder quality checklist or equivalent. It may not be based solely on receiving a certificate of analysis that may have been marked approved. By itself, that does not at all document that all appropriate associated records have also been reviewed and found to be okay. So you must have both of those items. The product receipt acceptance document created by the product owner or the distributor if you're using a contract distributor. That means as you receive product, you must verify that it is what it's supposed to be, that the description of it on the shipping records, on your purchase order, and on the item packaging, the packaging of the items itself, agree with each other, and that what we recommend, you should be doing some very fundamental sampling to confirm that the product you've received matches a product standard. In other words, if it's supposed to be a brown tablet and what you have received is a white tablet, there's a problem. If it's supposed to be a clear encapsulated product and it's a red encapsulated product, that's a problem. So we recommend that you are comparing the received product visually to a standard that you have on file. The OLD, PLD quality unit product approval and release document must be issued. You have to formally document that release. It can't be a phone call. It can't be an email. It can't be a text. It's got to be some formal documentation. It could be in an approved, validated computer system, or otherwise some sort of a paper release for each product lot. The distribution requires that formal QA release by the OLD quality unit. And of course, you must maintain distribution records. That's pretty straightforward. We don't ever see or rarely see problems with it, but needs to have the proper information to allow for product traceability. And that includes product name, item number, lot number, quantities of each lot of product distributed, and names and address of the customer. That information must be maintained for potential product recall purposes. We haven't said anything yet about reserve samples, but it's something we need to deal with. And that is that reserve product samples, in other words, the finished product as packaged and distributed and sold, there must be reserve samples maintained by both the contract manufacturer and you, the product owner. Storage conditions must be consistent with the product label, and the container closure system must be the same as used in the distribution of the product. The product would be retained for 1 year past the declared shelf life or expiry date. If it's a dietary supplement and therefore it may not have a shelf life or best use by date, those samples of reserved product samples must be maintained 2 years from the date of distribution of the last batch associated with that reserve sample. An exception here deals with drug products, and it deals with what is called the API, the active pharmaceutical ingredient. It's only that ingredient for which there needs to be a reserve sample maintained. We advise that we believe it's adequate to have that retained only at the contract manufacturer's location, and it must be retained for 1 year past the expiry date of the last lot of drug product containing that API. So let's look at the fourth key area of responsibility, and that is monitoring contract manufacturers and packagers. This is done by the product owner quality unit in operations as operations people within your group as it may be appropriate. And it should include having on file copies of all specifications, having copies of master manufacturing, master packaging records, and approved formulas on file. Periodic sampling of batch production records, packaging records. When we say periodic, we mean some sampling plan by which you will monitor these on a sampling basis, and we advise basing it on the number of product lots you expect your contract manufacturer to be producing in any 12-month period. So if it's, for instance, 100 lots, square root of n plus 1 is a sampling plan that FDA very much likes to see used. And that means if you've got 100 lots expected to be produced, that's 10 plus 1, square root of n plus 1. 11, that means you'd be looking at least 11 sampled batch production records. And typically, and simple way to do that is to round it off and say, we're requesting from you, our contract manufacturer, every month we want you to send us a batch production record for each of the products you're making for us. Then there also would be periodic on-site audits that could be in addition to the original qualification audit with audit reports. Those periodic on-site audits would be based on you determining the frequency as appropriate based on his contract manufacturer. It could be as often as annually. It could be as seldom as every 3 years or longer if you have no problems with the contract manufacturer. There must be evidence that you, the OLD, have reviewed and approved, that is reviewed and indicate your acceptance of all of the above documentation. So one more item we need to cover as a responsibility you would have is dealing with product complaints. And that deals with things like any complaints received from any source. You should be establishing a complaint log, keeping track of each complaint that's been submitted, who made the complaint, what product, what lot, if you can determine that, et cetera. A number of things to be in that complaint log, including the decision to investigate further or not. If the complaint is about something you know is typical of a product, like it's it's has a certain fragrance, then fine, that doesn't require an investigation. But many things will require an investigation. You need to be documenting that decision to investigate or not. You need to send the potential quality manufacturing CGMP compliance issue to the contract manufacturer if there is such an indication that it might involve compliance with CGMP or manufacturing defective procedures. Therefore, the contract manufacturer will play a part in doing an investigation at their end. The procedure should require, the complaint that is procedure should require that your target date for completing investigations would be 30 days with possible extension for unique extenuating circumstances. Final report goes to the contract manufacturers, is by the contract manufacturer for those parts that they've investigated. And the product unit quality owner would prepare the final report and sign off on it, including their own work that they've done and what the contract manufacturer may have done in the investigation. And one other piece to this is about serious adverse events. They must be reported to the FDA using their MidWatch program within 15 days of receiving the complaint. And you may ask, if you're not familiar with what a serious adverse event is, it's an alleged event based on product use by one of your customers, one of the people who've used your product, that the product resulted in death, a life-threatening experience, or an inpatient hospitalization, and may, if it has required a reasonable medical judgment that by medical or surgical intervention to prevent the outcome just described, that is hospitalization or death. So it's any of those things that are alleged in a product complaint, they need to be reported to the FDA as a serious adverse event. What about computer systems? If you are or your contract manufacturers are using computer systems to assist them in compliance with CGMP, those functions within the system or the entire computer system is required to be validated or qualified. If not, then it's required that you have hard copy records to support all of those steps in operational procedures for CGMP compliance issues. Now, there are some items beyond the scope of this prep seminar, which I wanted to mention to you because they are important and they do potentially apply in whole or in part to your products. The one is that the one I mentioned is the Food Safety Modernization Act that was promulgated in 2011. It includes 7 major rules that are focused on foodborne illness prevention, including. And we talk about foodborne and why that applies to you is because dietary supplements are basically regulated, including with are regulated under food regulations as well as dietary supplement regulations. So there are some things mixed into here to this, which can apply to both dietary supplements and foods for which you need to be aware. One is 27 CFR 117, which is a regulation that includes GMP compliance, hazard analysis, and risk-based preventive controls for human food. That was established in 2015. There is another requirement, another rule, foreign supplier verification program that involves foods and dietary supplements. It includes a requirement to meet applicable U.S. food safety standards. And that involves verification activities and records associated with those verification activities. And then there's the one that's just been drafted in September of last year. Traceability of Foods would require that if you're using any foods that are on the list that they've developed under the food traceability list in your dietary supplement product, then you have to meet the requirement of the record keeping that's required under Traceability of Foods. And just be aware that compliance with 21 CFR 111 for dietary supplement GMPs may exempt some parts of these above rules, but not all of them. So you need to be familiarize yourself with those requirements. And the last one that is of significance to you is FDA import alerts. These are alerts that notify FDA field staff and the public, and also therefore the contract manufacturers, that they have determined there's enough evidence of potential violation of FDA regulations that the FDA can detain those products without physical examination. In other words, they can make the decision, these products will be detained and they won't be allowed to be distributed or fully imported beyond the point of receipt. And these regulations apply, these alerts apply to all FDA regulated products. They give you a brief feel of what activity there is related to FDA import alerts. This shows data from 2019. There were 14,637 refusals from the importing process. And you might want to know that for total foods and dietary supplements, FDA doesn't separate those out in that category, but some are foods, some are dietary supplements. But anyway, combined, they accounted for 50% of the refusals. And for drugs and biologics, it was 18% of the refusals. And you might want to be aware that depending on whether you're importing products from various countries, the most refusals, 34% of them, occurred related to products manufactured and being imported from China, India, and Mexico. Something to be aware of and be particularly conscious of. The final thing that you should be aware of is that in FDA, in their inspections, they commonly will include inspections of your either during the inspection itself on site or either before or following their inspection. They commonly will take a look at your labeling, promotional brochures, advertising, and website content. And it's not unusual for them to find observations, particularly in the dietary supplement world, of products being misbranded or indicating in their judgment that you're describing a new drug, which has not been approved or it's inappropriate claim for a dietary supplement product. But those kinds of observations occur just about as frequently when you look through the data on the FDA website, as frequently as observations made for actual on-site observations for compliance with regulations relative to the manufacturing, packaging, and distribution of products. So it's a very active inspection that FDA does of those kinds of documents, labels, brochures, advertising, and websites. Okay, so that concludes the formal part of our webinar, and I want to thank you for your participation and attention, and I'll now turn the webinar back to Amy Scanlon. Thank you.
Great, thanks so much, Bruce, and thanks everyone. We have a ton of really good questions out there. I also just want to mention as we go into the Q&A, of course, you've got the Q&A box on your screen. And if you have questions, please type them in. We don't have the ability to unmute any microphones. So I see a couple people have raised their hands, but if you could just type your questions in, that would be perfect. Additionally, we do have a dietary supplement GMP seminar coming up. So for everyone who is in today's audience, if you would like to join us, we're offering an additional 10% discount off of registration. You can use webinar 10 at checkout and get that discount code. And now we will get to the questions. And Bruce, the first question is, if a CMO is not qualified, can I use the data in their COA?
The answer is only if you have otherwise qualified that data by doing or having someone do independent third-party testing that you, if you have the ability, or some other laboratory that you would use to confirm that the results indicated on the C of A match the independent parallel testing of the same material or product.
Next question, should the brand owner have a specification or can the CMO's specification be used?
When you say the brand owner, I assume that means the contract manufacturer. If that's what you mean, I'm sorry, would you reread that question just to be sure I haven't missed the point?
Sure. Should the brand owner have a specification or can the CMO's specification be used?
Oh, if it's as the own label distributor, private label distributor party, if you have established a specification, that's the optimal approach. Your specification is what your contract manufacturer must meet. If that's the case, then yes, it's your specification that you're providing to your contract manufacturer. He must meet your specification. Many times it's the reverse, that the contract manufacturer has a specification developed for a product or a similar product. They collaborate with you to develop a product spec for your product. And then in that case, you need to, as we mentioned during the presentation, you need to either sign off on it or at least review it and initial and date it and put it on file that said, this indicates you have seen it and agree with it.
Next question, can the quality agreement allow the CMO to approve MMR specs and release?
Yes, but not totally. They would be required to approve it. That's a basic requirement because, as we said, they're going to be the primary party inputting and drafting that master manufacturing record. But you remember we said that you need to be at least seeing a copy of that and reviewing it and confirming that you are okay with it and putting it on file. That way you can satisfy yourself. You know what that contract manufacturer is doing to make your product and you are okay. You don't see any exceptions. And it's also what you then can show the FDA that you're aware of what's happening and how your product's being made. So yes, they would be approving, the contract manufacturer would be approving that master document, but you should be seeing a copy of it and agreeing with it and putting it on file.
All right, thank you. Next question, do dietary supplement holding facilities, are they required to follow GMP regulations?
Yes. There are not too many, but yes. One is that I did mention within the presentation, if you're using a contract distribution facility, or if it's your own distribution facility, either way, the receipt of the product needs to be confirmed as being the right product, as I explained earlier. If it's a contract distribution facility, the same thing applies. They need to confirm what they received is the right product and then send a report of their confirmation to you. But there are other regulations they have to comply with, and that is their warehousing conditions must be consistent with product labeling. They must have systems in place for if they are then the distributor, which we're talking about, they'd be the distributor, that they maintain records as required by regulations. There may be some issues related. We're getting into the weeds here a little bit, but if they have to maintain specific environmental conditions, then they will have had to done and documented that they know the conditions in the warehouse are meeting those requirements. That is by doing temperature, humidity mapping, and periodic monitoring of those conditions. So that's all about, yes, complying with FDA regulations.
Great, thanks. I see another question, which is in reference to Fisma and what part of this applies, what parts of Fisma apply to dietary supplements. And Bruce, I don't know if you want to touch on that. We do have so many questions. I will mention.
Well, I'll just say that's a bit of a complex issue, and it's one that can't be explained in just a minute or two, and certainly should have somebody more experienced with Fisma than I am.
And I was going to say in my follow-up email, I see also a couple questions as to whether we're providing the slides. Yes, I'm going to send the slide handouts. I will send a copy of this recording. And in addition, we have a couple articles and a Fisma or FSVP for dietary supplements webinar that was produced in the last year. So I will include links to all of those, and that way those who are interested in Fisma and supplements will be able to refer to those. So moving on with these questions, when you refer to drugs, does this apply to all OTC topical drugs such as sunscreens?
I missed when you said, what's the word after you say when you refer to what?
When you refer to drugs, does this apply to all OTCs?
Yes.
Okay. If you
including product with sunscreen, because that makes them a drug.
Okay, great, thank you. If you distribute products that have been private labeled for you, can you relabel at the distributor for another provider?
I don't see why not, as long as your approved procedures call for doing that and specify, and you have a specification for the labeling you're doing, or the over-labeling, if you're talking about over-labeling or relabeling. As long as your records show what product you used, what did you receive, was that properly approved, and were the labels meeting specification and approved, and you do a full accounting of that labeling operation, including label usage reconciliation, I believe that is okay to do as long as all of that is documented.
Great, thank you. Someone is asking if you can clarify the difference between an OLD and a PLD.
An OLD, own label distributor, is the term that the FDA uses in relation to dietary supplement companies. It's just a nomenclature differentiation. PLD is what the FDA refers to those who use, in both cases, we're talking about companies using contract manufacturers or contract services as part of the production of their products. So PLD is what the FDA in the drug end of the business uses as the designation of the equivalent of an own label distributor, but it's PLD for drugs, OLD for dietary supplements.
Does a third-party fulfillment center need to be FDA registered?
Yes.
Okay, I'll also mention that EAS can handle your drug facility registrations. When I send the email on the recording and the slides, if you would like information on that, send me a note back. I'll be glad to get that information to you. Can the CMO QU act as the OLD QU?
No. No, it must be the quality unit. Both organizations must have a quality unit to do their meet their respective responsibilities. That's a distinct conflict of interest if you do not have a quality unit to meet your responsibilities for those quality functions. You must be responsible for, particularly when we talk about release of product or distribution. You cannot rely on quality unit at the CMO to meet all of your responsibilities that would normally be part of your quality unit's responsibility. So no, you cannot delegate, and that's what those warning letters say. You may not delegate certain quality unit responsibilities to the contract manufacturers.
Okay, great. We have time for one more question, unfortunately, because we have a number of additional ones. But I think this one certainly applies for many of the smaller companies in the audience. And that question is, what are the least amount of requirements? What are the least requirements in order to comply? This person is the only person responsible for the entire operation of the company, as well as quality assurance.
That is a very difficult situation. And it's one of the things that the FDA has concerns about. You cannot ignore the responsibilities of the quality unit being established, as we mentioned in the presentation, for your own company, even though it is a tiny company, in this case described as having only one person. The reality is you've got to do something to identify that you have, and if you keep it the same way, the same organizational structure as one person, then you would have to have it documented that you also have the quality unit responsibility and that you are qualified to have that responsibility, to exercise that responsibility. And if you're not, the only alternative is to add someone in your organization who can meet those requirements. There are some exceptions, and it's hard to get into this. There are some possible exceptions, and I will tell you this is a gray area we've dealt with a couple of clients recently, where they want to use a third-party quality unit. And there are some companies established to do that. I can't recommend any that, even if I knew who they were. It's not clear whether the FDA fully accepts that or not. In other words, you say, okay, we're a small company. We don't have quality people, a quality unit in our company. We are contracting that service to a qualified third party. There is no clarity on whether the FDA is okay with that or not. Some companies are doing it. That's all I can tell you.
Great. And I'll also mention, of course, as you might expect, DAS would be glad to help if you need records reviewed, need help developing quality agreements, developing SOPs for even smaller organizations. Of course, our consultants, such as Bruce, are great resources, and we're always glad to help with that. So it is 2:02. I thank everyone for sticking with us today, and thank you, Bruce, for a fantastic presentation. And we look forward to being of assistance to anyone who needs it. Feel free to join us for our upcoming dietary supplement focused webinars that are complimentary. We have one on out of specifications. We have another on supplier qualification. And of course, if you're interested in joining our dietary supplement GMP seminar, excuse me, you can use webinar 10 at the checkout and receive 10% off. So thanks everyone. We look forward to seeing you again soon. And thanks again, Bruce.
Okay, thank you and goodbye for now.